Welcome to the West-MEC Nursing Assistant Program. This program is here to prepare you for a real career in healthcare. That means this is more than just a regular classroom. The habits you build here matter. The Nursing Assistant Program follows the professional standards expected by West-MEC, our clinical partners, and the Arizona State Board of Nursing. Students are expected to show professionalism, respect, accountability, and safe behavior in every setting. Students are expected to show respect toward instructors, classmates, staff, patients, residents, visitors, and equipment. That means using professional language, listening to people with courtesy. So, respect everybody and everything? Exactly. Even the blood pressure cuff has had a long day. That's the spirit. Respect builds trust and makes our work environment much more pleasant for everyone. Students are expected to arrive on time and prepared for class, lab, and clinical activities. That means proper uniform, needed materials, and being ready to participate. I'm ready. Excellent. That is what we like to see. Professionalism includes appearance, communication, behavior, teamwork, honesty, accountability, and respect. In healthcare, people need to know they can trust you. Healthcare professionals do not hide mistakes and hope the mannequin forgets. Students must follow all classroom, lab, simulation, and safety rules. You may perform skills only after instructor demonstration and authorization. So I should not just guess? Correct. I thought this looked right is not a healthcare strategy. Testing. That is a stethoscope, not a concert microphone. Students must respect all equipment and supplies and should not touch or use equipment without instructor permission. Students must follow all infection control and safety procedures. That includes hand hygiene, correct glove use, and safe lab practices. Gloves are helpful, but they aren't magic. If you touch everything in the room, you still have contaminated gloves. Students are expected to participate actively in classroom and lab activities. That means listening, practicing, helping your team, and staying engaged. Okay, gently support the wrist like this. Cell phones and other electronic devices may only be used when I authorize them. Otherwise, they should stay stored. Yes, Mrs.B. If your phone is whispering, check me, the answer is still no. Unauthorized use may lead to disciplinary action. Students must follow all HIPAA and confidentiality requirements. Private patient information must stay private. So no posting, sharing, or gossiping? Exactly. Not in class, not online, not in group chats, not anywhere. Students must refrain from threatening, intimidating, harassing, bullying, or making inappropriate remarks or actions. In healthcare, people must feel safe and respected. Cruel comments do not belong in a professional environment. Examples of code of conduct violations include disrespectful behavior, excessive talking, ignoring directions, unauthorized equipment use, cell phone violations, unsafe lab practices, poor infection control, bullying, threats, damage to equipment, and confidentiality violations.
Code of conduct violations may result in one or more disciplinary actions. These can include a verbal warning, written warning, parent or guardian contact, referral to administration, removal from activities, loss of professionalism points, suspension from clinical participation, program probation, or dismissal from the program. The goal is correction and accountability, not surprise plot twists. Because healthcare education involves real safety concerns, instructors may skip progressive disciplinary steps when a violation is serious. Threats, major safety violations, confidentiality breaches, or conduct that puts others at risk may lead to immediate removal from class, lab, clinical experiences, or even dismissal from the program. Patient safety always comes first.
Every day, you will make choices. Choose respect, safety, honesty, and professionalism. If you are unsure, ask. That is a sign of responsibility. I understand, Mrs. B. Thank you. The expectations in this program are high because the work of healthcare professionals matters. Bring your best effort, your professional attitude, and your willingness to learn. Good job, Muffin. Security remains tight.